If your kitchen counter is currently buried under a stack of glossy mailers, or your phone hasn't stopped ringing with important Medicare updates, then you already know the marketing machine is running on pure adrenaline. Insurers are fighting tooth and nail for your business, and they're not shy about it. But here's the kicker. What they're not telling you is the complete picture. You see, every single county across the country can be a completely different landscape when it comes to Medicare Advantage plans. We're talking anywhere from a handful of options to well over 100, all vying for your attention. The commercials? They'll flash a free gym pass, promise dental coverage, or brag about a $0 premium. And yeah, those things sound great. But they're just waving a shiny object, hoping you'll bite without knowing what else is out there. What if there's a plan with even better dental benefits for your specific needs? What if that $0 premium plan has sky-high co-pays for the services you actually use, making it far more expensive in the long run? Without knowing the total number of plans available in your specific zip code, you're flying blind. You can't tell if you're missing out on a genuinely better deal, or if you're just seeing the same old plan repackaged 20 different ways with slightly tweaked names. It's like trying to pick the best apple from a bushel when half the bushel is hidden from view. You need the whole picture, not just the pretty ads. This lack of transparency, this deliberate obfuscation, is the real problem. You deserve to make an informed decision, not one based on the loudest commercial or the thickest mailer. So, how do we cut through the noise and get that full picture? Simple. We go straight to the source, the undisputed champion of Medicare information, Medicare.gov. This isn't some sales pitch masquerading as a helpful tool. This isn't an insurance company trying to push their own products. No, Medicare.gov doesn't sell anything. It simply lists it's the ultimate neutral ground. Think of it this way. The Medicare Plan Finder tool pulls every single approved contract for Medicare Advantage plans in your specific zip code. It hides nothing. It holds nothing back. And it updates nightly, meaning the information you see is as fresh as it gets, reflecting any changes that might have occurred. This isn't some static brochure. It's a living, breathing database of your options. In fact, it's the exact same raw data feed that brokers and agents use to find plans for their clients. The only difference? You get it directly, without having to sit through a 45-minute sales seminar or feel pressured to commit to anything on the spot. It's your information, on your terms, whenever you need it. This tool empowers you to be your own best advocate, armed with all the facts. Alright, let's get down to brass tacks. This is where the magic happens. 1. Open Medicare.gov. Seriously, just type it into your browser. Double check that it ends in .gov to ensure you're on the official government site, not a look-alike. 2. Click Find Plans Now. Or choose the year you need coverage and enter your zip code. They update it automatically. This is your gateway to clarity. Click Continue. 3. Choose Medicare Advantage. Click on Find Plans. Remember, Medicare Advantage plans, sometimes called Part C, are offered by private companies approved by Medicare. They bundle your Part A, hospital, and Part B, medical, coverage, and often include Part D, prescription drugs, and extra benefits like dental, vision, and hearing. This is what we're focusing on for now. This is crucial. Medicare Advantage plans are highly localized, so what's available to you depends entirely on where you live. Pop in your 5-digit code. Choose Do You Get Help? 4. Hit Continue, easy peasy. 5. Skip the drug list for now. I know. It sounds counterintuitive, but trust me on this. We're just trying to get the total count right now. Adding drugs is a time-consuming step best saved for later, once you've narrowed down your options. We'll talk more about that in a bit. 6. And boom, there it is. Your exact, unfiltered, comprehensive total. In my zip code, for example, it's 58 plans. That's 58 distinct Medicare Advantage plans available to someone living right here. No guessing, no vague commercials, just the hard numbers. Now, let's make those numbers work for you. See that filter option on the left side of the screen? That's your best friend. Flip it open and select plan type. You'll see categories like HMO, PPO, and SNP. HMOs, health maintenance organizations, are typically more affordable but require you to stay within a specific network of doctors and hospitals, often needing referrals to see specialists. In my zip, that brings the 58 down to 34. PPOs, preferred provider organizations, offer more flexibility. You can usually go outside the network, but you'll pay more for it, and you typically don't need referrals. Here, that's 18 plans. SNPs, special needs plans, are tailored for folks with specific chronic conditions, like diabetes or heart failure. Those who qualify for both Medicare and Medicaid, or those living in nursing homes. In my area, there are 6 of those. You might also see less common types like PFFS, private fee for service, which allow you to see any Medicare-approved provider who accepts the plan's terms, or MSA, Medical Savings Account, plan. Click Filter again, and this time, choose Insurance Company. Now you'll see exactly which carriers are offering plans in your county and how many each has. This shows you who's really competing for your business. It's all there, laid bare. No guessing. No phone calls to sales agents, no more mountains of mailers needed to get this foundational information. You're in control. This is where the Medicare Plan Finder truly shines, letting you personalize your search with incredible precision. You've seen the total, and you've glimpsed the major plan types. Now, let's really narrow it down based on your specific needs and preferences. Imagine you're thinking, okay, I need dental coverage. That's a must-have. Head back to those filters. Look for Plan Benefits, and simply check the box next to Dental Coverage. Watch what happens. That initial count of 58 plans collapses, maybe down to 27. Just like that, nearly half the plans are gone because they don't meet one of your non-negotiables. Let's explore some other common filters you might use. Vision or hearing benefits. Many Medicare Advantage plans offer these extras that original Medicare doesn't cover. If routine eye exams or hearing aid allowances are important to you, check those boxes. Fitness programs. If a gym membership or wellness benefits are a priority, you can filter for plans that include them. Provider networks. If you have a specific doctor or hospital you absolutely want to keep, the tool allows you to check if they're in a plan's network. This is crucial because many MA plans, especially HMOs, have restrictive networks, and going out of network can be costly or not covered at all. Star ratings. Medicare assigns star ratings, 1 to 5 stars, to plans based on quality and performance. You can filter to only see highly rated plans, giving you confidence in your choice. This real-time filtering is how you effectively shrink the haystack before you even start looking at premiums, deductibles, or specific benefits. You're not sifting through irrelevant plans. You're focusing only on the ones that genuinely align with your lifestyle and healthcare priorities. It's about efficiency and precision, ensuring you spend your valuable time evaluating plans that truly make sense for you. Now, here's a crucial point that can save you a lot of heartache and money down the line. The lowest premium isn't always the cheapest plan. I'm going to repeat that because it's that important. A $0 premium plan might seem like a dream, but it can quickly become a financial nightmare if you're not careful. Why? Because premiums are just one piece of the puzzle. You also need to consider deductibles, the amount you pay out of pocket before your plan starts to pay. Copays. Fixed amounts you pay for doctor visits, specialist appointments, or prescriptions. Co-insurance. A percentage of the cost you pay for services after your deductible is met. Out-of-pocket maximum, MOOP. The absolute most you'll have to pay for covered services in a year. Once you hit this, the plan pays 100%. This can range significantly, sometimes up to $8,850 for in-network services, or even higher if out-of-network care is covered. While the Medicare.gov Plan Finder is an incredibly powerful tool for self-service, there are definitely situations where navigating your options can still feel overwhelming, even with all these filters. Sometimes, the filters can still leave you with 20 or more plans that all look pretty good on the surface. This is particularly true if your doctor list is picky. If you have a trusted primary care physician or a team of specialists you absolutely must keep, verifying their network status across multiple plans can be a headache. You take more than 5 medications. As we just discussed, drug formularies are complex. If you're managing multiple chronic conditions with a long list of prescriptions, comparing the nuances of coverage, tiers, and potential prior authorizations for each drug across several plans can become a full-time job. You qualify for both Medicare and Medicaid, dual eligibility. These are called DSNPs, dual special needs plans. And while they offer incredible benefits, their rules and coordination can be intricate. Finding the optimal one requires a deep understanding of how both programs interact. In these more complex scenarios, that's when a licensed Medicare broker can be an invaluable asset. Think of them as your personal Medicare guide. A good broker is licensed in your state and represents multiple insurance carriers, not just one. This means they can offer unbiased guidance, showing you plans from various companies to find the best fit for your unique needs, rather than pushing a single company's agenda. Crucially, here's the best part. Licensed brokers are paid by the insurance carriers, not by you. Their help is absolutely free to the consumer. They can run side-by-side comparisons, analyze your specific drug list against different formularies, and help you understand the fine print of network restrictions and out-of-pocket costs. They're there to simplify the complex, answer your questions, and ensure you feel confident in your choice. The tool is free, and their expert help is also free, and you still keep the final pick. It's about getting personalized support without any additional cost. If you appreciate getting your Medicare information delivered short, factual, and completely sales pitch free, then do yourself a favor and hit that subscribe button. I drop new videos every single week, especially during open enrollment season, to help you navigate this stuff with confidence. Don't miss out on more clarity. If you appreciate getting your Medicare information delivered short, factual, and completely sales pitch free, then do yourself a favor and hit that subscribe button. This is about empowering you to make the best decision for your health and your wallet. You're no longer at the mercy of marketing blitzes, you're in the driver's seat. And if, after all that, you still feel like you need a little extra horsepower to turn those numbers into the absolute right plan for your unique situation, Camaraderie Health Agency is here to help. Our number is right there in the description. Call, email, or yes, even send a carrier pigeon if you're feeling old school. We are licensed in 7 states. We're genuinely passionate about helping people like you, and we never, ever charge a cent for our guidance. Go forth, get informed, and choose wisely. You are invited to subscribe to Camaraderie Health Agency YouTube channel or go to www.camaraderiehealthagency.com or call 224-433-5754.